Now I have the real pleasure of introducing Dr. Lori Zephyrin. She is the Vice President, Advancing Health Equity at the Commonwealth Fund. So glad to have you here with us today, Dr. Zephyrin.
Thank you, and so honored to be here today and to be with all of you and just such amazing leaders and experts that are really moving this work forward. Today I just wanted to talk more about the burden of maternal morbidity and mortality and provide some data that complement some of the data that Dr. Barfield just shared. If you can take the next slide, please. As we all know, maternal mortality has been recently rising. There was a period of time where it had been gradually declining before recently rising. And, within those decades where maternal mortality dropped and as women started to have healthier living conditions and better maternity services, there was a lot of focus on, surgical procedures and access to antibiotics sort of in the earlier in the last century. And then an additional focus on really improved maternity services within hospitals as well. And this focus on improving maternity care in hospitals has had some consequences by not providing the focus on the importance of community-based care and also overlooking persistent racial disparities. If we go to the next slide, what we see here is that Black birthing people have been more likely to die than white mothers and birthing people for over 100 years, so over a century. And so to what Dr. Monica McLemore and others were saying this morning, we really need to intentionally address the driving causes and the driving factors if we're ever going to have an impact on these disparities that we've seen for decades. If you go to the next slide, please. And as we think about, some of the causes for this, even education is not protective. Higher education does not protect Black mothers from pregnancy-related deaths. And while educational advancement may have typically been seen as protective of health, that is not the case for Black mothers. And in fact, education exacerbates instead of mitigates Black and white differences in maternal health outcomes, where we see that 5 times as many Black mothers with a college education die as white mothers with a college education. If we go to the next slide, we're talking in this session about where we need data and where the data are. I think what's striking about this, 2 things. One is just the lack of data that are available. And I think we'll see those efforts change in terms of states having state-specific data with maternal mortality and maternal morbidity, thanks to Dr. Barfield's efforts and others. But what we also see is significant disparities across states, where we see that in some states, within our country, a woman's chance of dying in childbirth is twice as high in some states than others. And so it's really critical to understand this as we think about federal and state and policy action that can be targeted to help mitigate those disparities as well. If we go to the next slide, you can click one more time. Oh, I'm sorry, go back. And so despite us recognizing that maternal morbidity as well is a really important preventable issue for maternal and child health, there's really a need for continued government and community leaders really having additional success in having sweeping policy change to reduce maternal morbidity. Maternal morbidity or the near misses affects more than 60,000 women per year in the United States. It increases a family's risk for other mortality, for other clinical and societal adverse outcomes as well. And if you go to the next slide, there are not only substantial racial and ethnic disparities in the incidence of maternal morbidity, but also maternal morbidity results in reduced quality of life for parents and their children, and can result in disability, precipitate worse health and socioeconomic outcomes as well. And so there's really additional information and data and interventions that are needed to help guide policymakers and community leaders and health system leaders to really develop the business case to better understand the importance of maternal morbidity and the impact maternal morbidity has on people's lives and their health and social well-being. You go to the next slide, please. Why don't you click one more time, please. And when we think of the common drivers of health, Dr. Barfield talked about a third and a third and a third. And we see that about a third of the deaths occur during pregnancy. And if you can click again, please, and one more time. And this really looks at, it's still, the third and a third where if we're thinking about the deaths around just delivery and that birthing period, it's about 17%. But if we look from birth and beyond, it's a little more than half. And so as we think about the interventions that are required, it's really critical not just to focus on the delivery or birthing aspect or the prenatal aspect, but also think about that up to 1 year and beyond intervention as well. And really think about and understand the impacts of social determinants of health, including safe, affordable housing and a living wage and quality education, availability of food, of all those upstream factors that really have an impact on people's ability to be healthy and to live, have a thriving existence. And we all know that those are rooted in the impacts of structural racism, and not only in terms of structural racism affecting and driving the inequities and the social determinants of health, but also affecting the experiences that people have as they journey through their health care process. If we go to the next slide, I think this is a very striking slide. And to understand the limitations in the US healthcare system, it really helps to place our performance in the context of similar countries. And so this analysis where we look at 10 other countries with at least 300,000 births and a GDP capita of about 40,000 or more. And this is looking at, we see that the US ranks 10th last essentially overall. And this doesn't look at Black and white disparities within these countries, because there are data in the UK showing that Black and white disparities are 5 times. This is just sort of looking overall at just where we rank in terms of other countries. And even though the US spends more on healthcare than anywhere in the world, it has the highest rates of these preventable deaths, which is really shocking. And if we look at this next slide as well, this just places some of the other data shown previously into perspective in terms of the disparities that we are seeing within our US healthcare system and how we compare to others as well. So why are some of these things happening? I mean, if we think about from a systems perspective, our healthcare system has a shortage of maternal health care providers just overall, OB-GYNs and midwives, and also has an underrepresentation of midwives compared to other countries, for example. And in several countries, other countries, particularly European ones, midwives are at the center of delivering maternity care, where in the United States, midwifery services are not always covered by insurance or available in that region of the country, or have the availability of culturally concordant midwifery providers for people that may want to access them. If we go to the next slide, please. And, I talked a little bit earlier about these social determinants of health. I think this is just one additional aspect of it, where if we look at weeks of paid maternity leave, out of all these countries, US is the only country not to guarantee weeks of paid maternity leave. And if you go to the next slide, not only are women not guaranteed paid maternity leave in the US, there's not a guarantee of having health insurance throughout their lives. And if we think about pregnancies and into the postpartum period, where from birth and beyond, where more than half of the maternal deaths occur, we see that, Medicaid, for example, which pays for about half of US deliveries, currently extends postpartum care up to 60 days. And though we have recent legislation to help advance that and move that across all states, hopefully some states are still continuing to extend it to 1 year as well. But when we look at our counterparts in other countries, they not only have postpartum care, but also provide postpartum home visits, which in the United States varies by state and Medicaid plan, for example. And so if you go to the next slide and we think about these policy implications, whether we're talking about an undersupply of maternity care providers or a lack of paid leave, which is also a recognition of also lack of other social services, and also lack of postpartum care, we understand some of the policy implications to really think about how to address some of these system issues more broadly that we experience in the United States. If we go to the next slide, Medicaid has an opportunity, just given the number of births Medicaid covers. In some states, more than others, up to half of births. In some states, it can be up to 2/3. And we see just the number of births by Black birthing people who are covered by Medicaid as well. And so thinking through policy changes and enhancements in Medicaid, there's really has a significant opportunity to impact women's health, including maternal health. And especially as we think about maternal mortality and these drivers, it's really important as we think about policy solutions to address opportunities in Medicaid as well, to be able to expand coverage and services across all states. Go to the next slide. One example of this is, recent analyses that we supported through the Urban Institute. About a third of uninsured new mothers would be eligible for coverage with a 12-month postpartum Medicaid extension. And so that's a significant amount of people that can be covered by just having postpartum Medicaid extension. And so there's really a significant opportunity to address the inequities we see in maternal health through Medicaid, though this is not the only venue as well. If you go to the next slide. And it's also important to think about, as we think about the inequities and failures within our maternal health system, we also have to think about it within the broader system as well, and really thinking of the importance of comprehensive primary health care and really designing gender-specific primary health care, as well as primary health care integrated into coverage so that birthing people have access to care before and beyond pregnancy. And so strengthening primary health care and creating a framework to integrate gender-specific health into primary health care, and potentially using postpartum care as a transition point into primary health care is really critical. I mean, we can't separate maternal mortality and morbidity from the systems in which they arise. If we go to the next slide as well. And as we think about racial equity in maternal health, there's really thinking about addressing sort of how the systems are structured, but also as we address unequal treatment is really important. One of the panelists earlier mentioned sort of this medical, segregation that we're seeing, and how care is organized, where Black serving hospitals are more likely to perform worse than 12 of 15 indicators and have higher severe maternal morbidity rates than white serving hospitals. We know that in terms of unequal treatment, Black women are less likely to receive necessary screening or receive mental health treatment, and are less likely to receive health guidance on core maternal health conditions. It's really important also to address unequal experience, where Black women also report being treated unfairly and with disrespect, or experiencing discrimination, or not having decision autonomy. And so in order to address these unequal outcomes, you really need to think about this unequal treatment and unequal experience to really ensure that we're addressing these unequal outcomes. And with next slide, please. And COVID-19 has really brought upon us, obviously, additional challenges as we think of the collision of these two crises, where the maternal health crises and this crisis in COVID-19, where we see that the people that are mostly impacted by COVID-19 are the same people that are mostly impacted by these maternal health inequities. And Dr. Barfield talked a lot about just the pregnancy impacts of COVID-19 and some of the disparities. But also if we look at this next slide, this is just striking statistics just more broadly that just really show just the long lasting impact of COVID-19 now and I think years to come. I mean, it's really erased life expectancy gains between Black and white adults, right? And so as we think about, really tackling this maternal health crisis, we really have to understand just the sense of urgency that we have now, and really utilizing this event where we're all gathering to talk about solutions and data, really helpfully use it to continue to advance maternal health equity. And I just want to end off with a few more slides, in terms of, I talked about some policy solutions and talked about some of the data as well. There are also a lot of data supporting solutions, and other panelists will get into this on other sections as well. But there are significant community-based models that are available, that are proven, that are evidence-based to improve maternal health equity. We know what to do. Whether we're talking about integrating doulas or really having midwifery-led models of care, integrating our perinatal health teams, providing group prenatal care, or thinking about models of pregnancy medical homes that may integrate, for example, birthing centers, and really create that care across the lifespan that's really culturally concordant and culturally centered. We have a lot of data on what to do, which is very exciting, and we also have a lot of policy will to hopefully move this work forward as well. If we go to the next slide, COVID-19 has highlighted a lot for all of us. It's obviously unveiled for many the impact of structural racism on our society. It's also shown us how quickly we can move and how quickly we can implement changes. And as we think about the same communities that are impacted by COVID-19, are many of the same communities that are impacted by this crisis of maternal mortality and morbidity, really making this action more urgent. And so as work moves forward to invest in a diverse perinatal workforce, or strengthening and supporting birthing centers, or even work around extending postpartum Medicaid coverage to 1 year, it's really even more urgent now that we make these investments. So I really want to thank you for your time. Next slide. And really looking forward to hearing from the other panelists as well and hearing your questions.